Hello, I'm Pinakin Dave, Professor of Optometry at Western University of Health Sciences, and it is indeed my pleasure to welcome you to this video lecture. Functional testing in glaucoma. Visual fields is almost synonymous to functional testing in glaucoma. Although we have ERG and VEP, most of us use visual fields as a standard of functional testing in glaucoma. The threshold tests are the standard of care, particularly the central 30 degrees. Central 30-2, Central 24-2, which were initially introduced by Humphrey Visual Fields, is also available in Octopus Perimeter, and they have become the standard of care. The G protocol, which is a glaucoma-specific protocol, is found in Octopus Perimeter. Similarly, a 32 protocol is also found in Octopus Perimeter. Is glaucoma a peripheral disease? We thought the answer is obvious, yes. Then why don't we measure visual fields from 30 to 60 degrees? The answer to that question comes from the fact that visual fields can be very variable as we move away from center, and the data that is obtained from 30 degrees to 60 degrees is not very reliable, and we really require consistent, reliable data. Is the central retina more protected than the peripheral retina in glaucoma? And yes, that is possibly the case. The ganglion cell axons that supply to the central retina mix with the peripheral axons as they pass to the optic nerve, so they are more protected. But it's not as much as once considered. In fact, now we have numerous ganglion cell complex and OCT data studies that have shown that macular damage can be seen in early glaucoma. So then why do we not see central large defects in visual fields? The answer to that comes from the type of visual fields that we choose to perform on our patients. If you select a 24-2, the central region is represented by only 4 points, so it's unlikely that you would actually pick up damage. If one wants to see a damage, we could consider a G protocol, for example, which is a glaucoma-specific protocol, even though it is the central visual fields and there are more points that are represented in the central macular region when compared to a 24-2. What strategy should one consider when they're examining their glaucoma patients? This would depend on how good your patient can perform visual field, as well as how much time is involved in visual field test taking. A 24-2 CETA standard takes about 8 minutes, whereas 24-2 CETA fast takes about 6 minutes. So one would say, let's do the faster test. But remember, 24-2 CETA standard has better resolution and is better repeatability in its data point testing. So you have what you gain in terms of speed, you may lose in terms of its reliability of the data. A dynamic strategy of Octopus Perimeter is about 6 to 8 minutes, and it is an equivalent of CETA standard strategy that can be considered. Fixation errors can be a huge problem in reliability of the data. Humphrey Perimeter uses a blind spot monitoring of Hale-Krakow testing. As a first step, the blind spot is mapped. A bright target is projected where the expected blind spot is. Now, if the target falls exactly where the blind spot is, the person will not respond, and so the blind spot is mapped out as a first step during visual field testing. Subsequently, you get the strip chart at the bottom of the visual fields that tells you if the person has performed the visual field test correctly. If you see a large fixation loss like this, that could represent about 10 degrees eye movement, whereas a bar like this represents a blinking, or a bar like this may represent a tracking failure, meaning the machine does not know where the eye is. Octopus Perimeter does this slightly different. Octopus Perimeter uses continuous monitoring, where if there is an eye movement that is recorded, an automatic readjustment is performed. The machine moves itself to a right location so that there could be less interruptions and there's less time taken to finish the test. In fact, if the patient closes their eyes completely, the machine stops testing and says something like, patient is taking some rest. So you can pretty much depend on the data that's coming out, and we can be sure that it's not garbage data. Cluster analysis is a very intelligent and intuitive analysis that is performed specifically in the Octopus Perimeter. Individual data points of visual field may have some degree of fluctuation, whereas if you take a region and average it, that can be far more stable. You can look at this and say, well, this looks like the retinal nerve fibrillator pattern, and that is by design. If you look at these, they are more close representation of your retinal nerve fibrillator. If it shows a number like this, that essentially means that the cluster as a whole has gone down by certain decibels. And so this can give you a better structure and function relationship that we may be able to utilize in our clinics. In summary, the central threshold perimetry is the standard of care. For Octopus Perimeter, one should consider using dynamic strategy, and for Humphrey Visual Field, CETA standard protocol. when choosing the test, you really want to be sure that you use a quick test, but the test needs to be reliable and repeatable, and these are the key points that one should consider. Thank you very much.